My name is Benjamin Dropkin, and I'm a reconstructive and prosthetic urologist. Grew up in upstate New York near Albany. I went to college in central New York at a school called Hamilton. Then I went to medical school at Dartmouth in Hanover, New Hampshire. I matched into my residency for urology at Vanderbilt University in Nashville and completed a 5-year urology residency there. I then went on to do one additional year of fellowship training down in Dallas, Texas at a hospital called University of Texas Southwestern Medical Center, where I focused on urologic prosthetic surgery and urethral reconstruction, as well as correction of penile curvature, known as Peyronie's disease. I then went to the University of Kentucky, where I was on the faculty there for 4 years, performing surgery and teaching residents, and then had the opportunity to come here to Prisma in Greenville, and I'm very excited to be here. You know, one of the nice things about urology is that there's a wide variety of conditions that we're able to help patients with. I think one of the best things about urology is that we have the opportunity to really help improve quality of life for people. And so each individual urologist's specialization and area of expertise is a little bit different. But for me, I focus on helping restore quality of life for men who have issues with, number 1, scar tissue in their urethra so they can't pee well. Number 2, problems after prostate cancer treatment, such as leaking urine and needing to wear pads or diapers, or the inability to get an erection even with pills and/or shots. And number 3, men who have penile curvature due to scar deposition that we call Peyronie's disease. So I decided to go into urology because I understood that it offered the opportunity to help restore quality of life and sometimes extend the length of life with surgeries that usually worked to help people achieve their goals. We also get to help people with very intimate problems that really affect their quality of life. And so I found that combination of surgery and being able to help people with really difficult problems very attractive, and it's been a very rewarding career for me so far, and look forward to many more years ahead. When it comes to educating patients, I'm a very firm believer that my role is to help people understand what's going on and what their options are for treatment. Doing nothing and continuing to just monitor the situation is always an option for a patient. I ultimately believe it's the patient's body, it's the patient's health, it's the patient's choice. But my job as an expert in these fields is to help people understand the risks and benefits of their different options for treatment. You know, I'd say I hope to inspire health by helping people return to a higher quality of life. One example would be a man who's had prostate cancer treatment and is now leaking urine into pads and diapers. This is often an incredibly difficult situation, emotionally, physically, limits physical activity, limits interest in being social. And so to be able to help someone like that get out of pads and diapers ideally, or at least minimize it so that they can return to activities they really enjoy, is something that I've found very rewarding and really love to do. When I'm not at work, I really love spending time with friends and family. My wife and I enjoy traveling within the country, and when we have the chance to go overseas, we love that as well. We love visiting national parks, hiking, just being outside. I also am a big sports fan, love playing and watching as well. Excited to be here in one of the epicenters of college football with a lot of amazing programs and stadiums, at arm's length. To schedule an appointment with me, please ask your primary care provider to make a referral.